All right, before we get to the viewer questions, we would like to ask you about the numbers released today. Active cases, the new cases from Saturday, and the positivity rates that are all at levels we haven't seen since January of this year. First off, our numbers have been steadily rising for nearly 2 weeks. Do you know what is causing this increase?
Yeah, so you're absolutely right. Unfortunately, the numbers in New Hampshire continue to go up. We're averaging now over 600 new infections per day. Our test positivity, as you mentioned, is over 7%. We have over 200 people hospitalized today with COVID-19 throughout the state. Deaths from COVID-19 continue to be too high, and any death is too high. The reasons for this really are multifactorial, right? I mean, we know that COVID is circulating in our communities. The risk is there. People are traveling more. People are taking less precautions. And so I guess it's not surprising that the levels of COVID-19 in our communities continue to be high, but I think it highlights the need for people to continue to take steps to protect themselves and prevent COVID-19 from spreading person to person. First and foremost, amongst these steps that people can take is to get vaccinated.
So are there any particular parts of the state getting hit harder right now?
All areas of the state, all counties, all regions continue to be at a substantial or a high level of community transmission. So really the risk from COVID-19 exists statewide. And I think we're seeing that play out in, our schools and our communities across the state, where we're seeing, higher numbers of clusters and outbreaks this year.
So what advice do you have for folks right now, both those who are vaccinated and those who are unvaccinated?
Yeah, so the risk from COVID-19 exists in communities. The first recommendation is for people to get fully vaccinated if they're not already fully vaccinated. And then second, if people qualify for booster doses, if they're allowed to get booster doses, we are recommending booster doses for a great many people who are 18 years of age and older, and maybe at increased risk from severe COVID-19 or at risk for being exposed and spreading it to others. But in this period of transition, while we're still trying to vaccinate more and more people, the general recommendations over the last year still apply. We're still recommending that people avoid really high risk situations where large groups of people are gathered. We're still recommending that people practice physical distancing to the extent possible. New Hampshire and CDC and other public health agencies around the country continue to recommend mask use, especially indoors, as one of the important mitigation measures. So while we're working to get more and more people vaccinated, especially our children, it's important for people to continue to take precautions to prevent spread of COVID-19 and to protect themselves and their families.
All right, let's get to the viewer questions right now. Rebecca writes in asking, my son is turning 12 in December. I asked his pediatrician if he should get the 5 to 11 vaccine now or wait for the full dose when he turns 12. His pediatrician didn't want to give advice due to not having enough long-term data. She writes, we think it's really important he gets vaccinated, but we're not sure what dose is best for him. What would you like to tell them?
Yeah, great question from Rebecca, and I absolutely agree. It is important for children to get vaccinated. And it's not just myself and other providers that are recommending vaccination. Vaccination in kids was unanimously recommended by the Science Advisory Committee. It's been recommended by medical professional societies like the American Academy of Pediatrics. So it is recommended that children 5 to 11 years of age, and then adolescents 12 and older, get vaccinated against COVID-19. The benefits of vaccination outweigh and any potential side effects or risks. I think to Rebecca's specific question on what the dose is that a child should receive, the recommendations on dose are really based on age. But they're not based on a child's size or their weight. They're based on age. And so a child that's 5 to 11 years of age is recommended to get the lower 10 microgram Pfizer vaccine dose. And then once a child turns 12, or a child or teenager that's 12 years of age or older, is recommended to get the higher 30 microgram dose of the Pfizer vaccine. So, I think this has been more recently spelled out in CDC's clinical guidance and clinical recommendations. So the recommendation is to get the appropriate vaccine based on the child's age.
All right, Dr. Chan, stand by. We'll have another round of questioning for you after the break.